We are in a climate crisis. It's also a health inequity crisis. Global warming and extreme weather events caused by climate change are directly affecting human health, in some cases claiming lives. That's why climate change has been recognized by medical and public health professionals as a health emergency. Extreme heat is the leading cause of weather-related deaths in the U.S. Here in the Pacific Northwest, the 2021 heat dome was the deadliest weather-related disaster in Washington state history, with at least 100 heat-related deaths, including 30 in King County. Climate change is also leading to longer and more frequent wildfires. The resulting air pollution has widespread health impacts, both short-term and long-term. Climate change also can damage critical infrastructure, such as transportation, energy and water systems, and supply chains. This can affect hospitals and other essential services like manufacturing, food production, and medication supplies. And these extreme climate events are becoming more frequent, more intense, and lasting longer. Climate change is the single greatest threat facing humanity. That's not just me saying that. The World Health Organization has stated that. Reducing fossil fuel emissions as quickly as possible is literally a matter of life and death. The reason I say climate change is also a health equity crisis is because the people most impacted by the climate change are those with fewer resources to protect themselves. Communities of color, low-income and immigrant households, people living unsheltered, outdoor workers, children, and the elderly. We know that people who have experienced environmental and structural racism are at increased risk for a wide range of poor health outcomes. Now, they're also at increased risk for suffering from health impacts of climate change. Healthcare systems play a critical role in responding to the health impacts of extreme weather events. What's less well known is that our healthcare systems are also major contributors to greenhouse gas emissions and global warming. At the same time, healthcare systems need to be resilient to the impacts of climate change on their operations in order to continue to serve their communities and provide essential care to their patients. We'll continue to see climate change-related power outages, flooding, and surges of patients into emergency rooms, as has happened previously during extreme heat events. And our healthcare systems also need to help patients prepare for and limit the current and future impacts of climate change on their personal health. Healthcare professionals play a critical role in responding to climate change. We can push to reduce healthcare's carbon footprint and develop sustainable practices in our organizations, building healthcare systems that reduce our negative impact on the planet. Healthcare professionals also play an important role as trusted messengers. We can deliver information on climate change and its health impacts to our patients, building their capacity to adapt. We need to invest more in climate change education, training, and capacity building for our healthcare workers. We need to build the knowledge and skills needed to recognize, prepare for, and respond to climate change-related threats. Public Health Seattle and King County is committed to helping our healthcare partners start and continue this important work. All of society, including the healthcare sector, needs to act with urgency to reduce greenhouse gas emissions and limit climate change while simultaneously preparing for its effects. There's a rapidly closing window of opportunity to secure a livable and sustainable future for all. By working together, we can make an impact to avoid the most catastrophic effects of climate change and improve the health of our community now and for generations to come.